KCBS, in partnership with UCSF Health, presents As Prescribed, a weekly conversation with leading medical experts from UCSF Medical Center and UCSF Benioff Children's Hospitals.
Hello and welcome to As Prescribed. I'm Alice Wertz. As the fight for reproductive health and bodily autonomy continues, the Food and Drug Administration recently approved the first birth control pill for over-the-counter use, which will be available in early 2024. With this move, the U.S. joins a group of more than 100 other countries around the globe that allow people to access birth control without a prescription. To tell us more about this, we're joined today by Dr. Mai Fleming. She's an assistant clinical professor in family and community medicine at UCSF. Thank you so much for joining us today, Dr. Fleming.
Thank you so much for having me.
So please share with us a little bit of background about the pill itself and the significance of this move by the FDA.
Sure, absolutely. So the approval of the Opill for over-the-counter dispensing is really an incredible step in the right direction after over a year of increasing infringements by many states on the right to reproductive bodily autonomy since overturning Roe v. Wade. Infringements that predate Dobbs, honestly, by many years, but have really reached historic degree of boldness post-Dobbs. So the Opill is a hormonal birth control pill that contains a single hormone, which is a progestin called norgestrel. Progesterone-only pills like Opill work by thickening the mucus inside of the cervix and essentially create a wall that blocks the sperm from entering the uterus or fallopian tube to fertilize an egg. This is a bit different from combined birth control pills, which contain both a progestin and an estrogen, which act together to stop the ovaries from releasing eggs. So studies have demonstrated that this particular progestin used in this pill is very highly effective, much more effective than other barrier forms of contraception that are currently available over the counter, things like condoms and spermicide. They're also really, really safe with less health risks and contraindications than combined birth control pills. In fact, we currently often prescribe progesterone-only pills like the Opill for people with underlying health conditions who are not able to take estrogen-containing contraception. We also know that based on studies, people are very excited. They're very willing and eager to be able to access birth control pills over the counter without a prescription. So this is something that people really want and really need. I think the ability of people to simply go to the pharmacy, pick up a safe and reliable form of contraception alongside things like their vitamins, their sanitary products, their condoms, will be incredibly powerful in people's ability to exercise their rights, to take back a bit of power, and to really achieve their own control over their health and their futures.
Who really benefits from this, Dr. Fleming?
Yeah, we know that from experience, legality and having access doesn't always equal the ability of everybody to access certain types of healthcare. So there are many people who historically have faced a lot of discrimination, a lot of stigma in accessing healthcare that will really benefit from this medication being available over the counter. In general, we have a pretty poor track record in medicine, particularly in serving people of oppressed and marginalized communities and identities, with pervasive bias and discrimination, oftentimes unconscious, rarely overt, that absolutely infiltrates in the reproductive healthcare space. What we've seen in studies is that particularly patients who are Black or Latina, particularly those with limited English proficiency, are much less likely to receive comprehensive contraceptive options counseling that values their preferences. And they may be more likely to be recommended things like long-acting reversible contraceptives, which is unfortunately a trend that is similar to previous cases of forced sterilizations of people of color, of incarcerated and detained people, of people of disabilities, and people of other oppressed and marginalized communities. So having an over-the-counter option enables folks to really bypass unnecessary, stigmatizing, and discriminatory healthcare experiences and really take matters into their own hands to access the medications they need to prevent pregnancy if or when they wish.
What are some of your hopes with this new approval of the Opill? As someone who's in the middle of the clinic, serving patients and from all different parts of, the community.
Absolutely. We know that there are many, many structural barriers to accessing healthcare where I usually am in clinic, even within public health systems, particularly for folks coming from communities of color, for young people, adolescents, and other people with marginalized identities. Things such as transportation, insurance, out-of-pocket costs of visits and prescriptions all stack up against people's abilities to really access the care that they need. And so what I'm hoping for is that we keep these barriers in mind and address them in the way that we implement the over-the-counter access. So the first step was getting the approval by the FDA. And the next step is how do we implement this in a way that ensures broad accessibility and equity in being able to access this tool for reproductive autonomy. So things like making sure that there's a broad availability of resources and information to help folks understand how to use the medication, what risks and rare side effects do exist, how to manage those side effects, and making sure that it's in language that's accessible for people and translated across multiple languages for those in whom English is not their first language. Making sure it's actually available over the counter. So, when we go to the pharmacy, there are some medications that you can just get on the shelf and some medications that even though you don't need a prescription, you have to go to the pharmacy counter. It's very important that this will be available on the shelf so that people don't have that additional step of needing to talk to a pharmacist who, particularly for folks who are at heightened risk of facing stigma and discrimination at those counters, including LGBTQ folks, including youth and adolescents. Making sure that the pill is actually affordable out of pocket. We know that out of pocket medications can be pretty expensive when compared to prescription medication. So having equitable pricing across the board, regardless of whether or not somebody is going to get it prescribed versus buy it over the counter, and ensuring that insurances, both state insurances, federal insurances, and private insurances are required to cover this medication, even though it is over the counter, so that people are still able to use their insurance and reduce their out-of-pocket costs. Making sure that when we do implement it, that there are structured implementation programs. So pharmacies know how to best implement it. What we saw was that when emergency contraception rolled out, there was a lot of inaccurate information, disparate policies, a lot of confusion so that people couldn't actually access the medication. And then just making sure that there are no ID requirements or age requirements so that young people, for people who don't have state IDs, are still easily able to access the medication.
Very important discussion. We are so glad you joined us today, Dr. Fleming. Thank you very much.
Thank you so much.
We've been speaking today with Dr. Mai Fleming. She's an assistant clinical professor in family and community medicine at UCSF. You've been tuning in to As Prescribed. I'm Alice Wertz.
As Prescribed, every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 and AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.